Hello everyone, I hope you all are doing well. I am Kashyap Razdan, a doctor by profession currently working in CGHS Jammu, and I welcome you all to our channel Doctor Simplified. Let's dive into the questions of UPSC CMS 2024 and search for their answers. Let's dive into the first 40 questions of set 2 of UPSC CMS 2024. The first question talks about ADPKD, autosomal dominant polycystic kidney disease. The statements are quite tricky because you have to know everything about the disease. Third decade is usually the most common presenting time, so 30 to 40 years and not 20 to 30 years. By this you can eliminate option A, B and D. So the answer is C, but it is a very tricky question. Second talks about ESWL. We know ESWL, PCNL and RIRS. All these three terms are used in relation to renal stones. So it's most commonly B. Urinary tract stones is the answer. Third question. The third question talks about the benign tumor of the brain. So brain tumors as such are commonly benign. So these are compressive symptoms which can be raised ICP, seizures, focal deficit or headache. So option A is the answer for third. Fourth question talks about neurofibromatosis. This type 1, we know that the common chromosome which is present due to this is chromosome number 17q. It is an autosomal dominant disease and characterized by café-au-lait macules, neurofibromas, axillary freckling, leash nodules, astrocytomas and neural crest cell tumors. So option A seems to be the right answer of this. Let's move into the foramen of Morgagni, that is diaphragmatic hernias. So we can easily rule out the statement first in this because it is right anterior. So you can remember the mnemonic RAM, right anterior ram, as Morgagni. So since option statement 1 is ruled out, so ABC is the wrong thing. D should be the correct answer for this. Let's move on to the sixth question. The sixth question talks about the keywords. Let's note down the keywords: improvement with time or as the day progresses, and symmetrical in nature. These two, along with this ulnar deviation, this talks about rheumatoid arthritis. So C should be the correct answer. Let's move on to the question number 7. The question number 7, the keyword we have to remember is diabetic. Frozen shoulder in diabetic is twice as common as in a normal individual. Question number 8. Question number 8, the keywords you have to remember is the dorsum of the wrist and also more prominence on plantar flexion. So we know that ganglion cysts which occur along the tendons, and so this is the right answer. Question number 9. This is an easy question. Upper motor neuron lesions characterized by increased tone spasticity, hyperreflexia and motor weakness. The plantar response, we know about the Babinski sign. So option B is the correct answer. Question number 10th. The question number 10th talks about ASAs. Since ASA, in this ASA 2 is the correct answer. I have in the keywords written down some of the important keywords which you should remember. 1 is for healthy normal individual, 2 is mild and controlled disease, 3rd is severe disease which is limiting but not incapacitating, 4th is a life-threatening disease, and 5th is a moribund patient which requires the surgery. Question number 11. What are the risk factors for wound infection? So this is an easy question in which third statement can be ruled out. So option B should be the correct answer for this. Now question number 12, which talks about the cancers which are related to ionizing radiations. So leukemia, lung cancer and breast cancer are common. Lymphomas are not as such heard related to it. Question number 13, which is Li-Fraumeni syndrome. We have to remember that it is an autosomal dominant disease. TP53, or which is a tumor suppressor gene, it is a mutation of that. Third thing which we have to remember is brain tumors can be there, sarcomas can be there, but leukemias as such are rare in it. So third statement itself is wrong, and option number C, 1 and 4th, is the correct answer to this. Question number 14th. Question number 14th, option C, intermittent claudication, should be the right answer. How can we differentiate it from neurogenic claudication? Neurogenic claudication, the pain is on the first step. As soon as you step on the ground, there is pain. So in this, the keyword which you can remember is pain is relieved while taking rest. Question number 15. This is a tricky question. Question number 15th, we know that from the question itself, we will know that cyst trunks operation, the answer is thyroglossal cyst. But let's learn what is the trick in it. Leads to post-operative need for thyroxine replacement. Thyroxine replacement would be given if the functioning thyroid gland or the functioning thyroid tissue is also removed with it. So thyroglossal cyst with only functioning thyroid tissue should be the answer. Let's move to the question number 16. What we can figure out from the question is leukoplakia, and first edge biopsy should be done of the lesion, and then later on there can be excision of that leukoplakia. Question number 17. Question number 17 should be an easy question to answer, because statement 3, the question talks about acute visual loss. Cataract cannot cause an acute visual loss, so statement 3 is the wrong statement. Option A, option B and option D are ruled out, so C is the correct answer for this. Let's move on to question number 18. Question number 18, malignant transformation should be the correct answer, because this talks about a benign tumor converting into a malignant tumor over a small period of time. Question number 19. Question number 19 as such is also kind of a difficult question, because it talks about the chromosomal abnormalities which are associated with brain tumors. Neurofibromatosis type 1, we know that it is associated with astrocytomas or neural crest cell tumors. Peutz-Jeghers syndrome does not seem to be the correct answer for this, because it is commonly associated with GI carcinomas, ovarian carcinomas and testicular carcinomas. Now move on to the question number 28th, which talks about neonatal galactorrhea or Witt's milk. Witt's milk is seen in full-term infants, that is the first option should be correct. Preterm infants it is not seen, and it is commonly due to prolactin and growth hormones. So these were the first 20 questions. Let's move on to the next half of today's video. Question number 21. The question number 21, which asks about the indications for performing damage control surgery. So hemodynamic instability should be there. Option B is, so option A is ruled out. In option B, acidosis should be there, but pH should be less than 7.2. Hypothermia should be there, and it should be less than 34 degrees Celsius. And coagulopathy is a short answer for this. So option D should be the correct answer for this. Let's move on to question number 22. Which of the features are given above are benefits of fracture treatment? So pain relief, prevention of infection and restoration of anatomy should be the ideal answer for this. Now moving on to question number 23, which talks about a bruise over the left mastoid process. The findings indicate. So we know that bruise over the mastoid process, which is commonly called, which we term as battle sign. So the common mnemonic for it is B for battle, B for bruise, B for basilar skull fracture, and B behind the ear, that is the mastoid process. Hangman's fracture, which is associated like with hanging. The option B is the correct answer, because it is spondylolisthesis, traumatic spondylolisthesis of axis vertebra, which is C2. Moving on to question number 25. This is a good question, SIRS, systemic inflammatory response syndrome. In this, I have ruled out option number, statement number 2, because bacteremia is not same as SIRS. Bacteremia is SIRS plus evidence of infection in blood. So we can rule out the options which contain statement 2, and thus 1, 3 and 4 should be the right answer for this. The question number 26, the answer is WHO surgical safety checklist, option D. Moving on to hypertrophic scars, option number 27. We know that silicone gel sheeting, intralesional steroid injection, triamcinolone and laser treatment. This should be the answer. Option number B, which is 1, 2 and 4th statement. Question number 28. These kind of questions, if I was about to attempt this paper, I would have left it because I cannot cram all this. The first statement, that what are the RDAs or daily requirements of the common electrolytes in an adult. Sometimes they can ask you, this is in millimoles per day. They can ask you in milli equivalents or some other units, if the milligrams or anything which they can ask you with. So what I have noted down is sodium is approximately the daily allowance or requirement is around 87 millimoles per day. Calcium is 1 millimole per day. Potassium is also around 1 and magnesium is 0.5 millimoles per day. So according to it, option B, that is 1, 2 and 4 should be the right answer. These questions are kind of bouncer questions which you can expect in this exam. Let's talk about the question number 29th, which is the distributive shock. Distributive shock, we know that there is vasodilatation, and if there is vasodilatation, there would be reduced peripheral vascular resistance, right? So option 1 and option 2 should be correct. The fourth question, which talks about the low cardiac output, this is the wrong thing because the cardiac output is increased in distributive shock. The best measure for organ perfusion and best monitor for adequacy of shock therapy is urine output. Moving on to question number 31, which talks about Barrett's esophagus. It is metaplasia, yes. It is a risk factor for the development of adenocarcinoma, yes. Ingestion of NSAIDs, it's not an etiological factor. Risk factor is GERD, the reflux disease, we know that. And endoscopic mucosal resection is an effective treatment, yes. So option number C, 1, 2 and 4 should be the correct answer for this. Now liver traumas, as I have discussed earlier in the videos, is liver trauma, spleen trauma, splenomegaly, a lot of questions which are important. So liver trauma is also one of the most important topics which UPSC is fond of asking. Which among the following are complications of liver trauma? Liver abscess can be there because following trauma, if there is ischemia, that is itself a seed for the infection or the abscess. Biliary fistulas can be there and liver failure as such can be there. So option 1, 2, 4 seems to be the feasible answer for this. Portal thrombosis cannot be there. I would believe if there is trauma, there can be coagulopathy or there can be increased bleeding tendencies as such. So portal thrombosis itself is a risk factor for cirrhosis of liver. Moving on to the next question, question number 33, which talks about the local complications of acute pancreatitis. So pseudocyst is there, ileus and acute fluid collection. These three are the correct options. So pleural effusion as such is a systemic manifestation of acute pancreatitis. So option D, 1, 3rd and 4th statement is the correct answer for this. Let's move on to question number 34. Which of the following are risk factors for the development of pancreatic cancer? Cigarette smoking, we know almost every cancer in our body which can develop as a result of cigarette smoking, chronic smoking. Diabetes mellitus can be there and male gender can be there. But pancreatic cancers as such are found more commonly in the African American people or the race. So option statement 3rd is the wrong statement. Option C is the correct answer for this. Splenic enlargement, splenomegaly, we have discussed about it, that splenomegaly, the causes is an important topic for the exam and thus it has come. In this, we will talk about which of the following are the metabolic causes of splenic enlargement. Amyloid and Gaucher's disease seems to be the correct answer, option number B. Question number 36, mesenteric cysts. So mesenteric cysts as such, this is also kind of a tricky question because mesenteric cysts are commonly found incidentally. It is an incidental finding. So we have marked option C. It presents most commonly as a painless abdominal swelling. Let's move on to the umbilical hernia. This question is a good question. Patients are commonly the option number B. Statement 1, 2 and 4 seems to be the correct answer for this. Question number 38, which is the most common cause of perforation of the esophagus? We know that iatrogenic is the most common cause. So mediastinitis, iatrogenic infection is not there, and malignancies, these can be ruled out. So barotrauma can be a better answer for this. Question number 39, stages of damage control surgery. Now we have seen till now 2 questions on this. So in damage control surgery, patient selection, control of hemorrhage and ICU care, these 3 are important. So 1, 2 and 3rd, option number A should be the correct answer for this. Let's move on to the last question, number 40th, renal cell carcinoma for today. Yes, it arises from the epithelium of the proximal convoluted tubule. So statement 1 is the correct statement. Statement 2nd is wrong because male predominance is more. So male is to female ratio is around 2:1. And statement 3rd and 4 automatically becomes right because if statement 2 is wrong, A, B and D can be ruled out. So option number C is the right answer. We will in the upcoming videos as well discuss about the leftover questions of set 2 and later on set 1, and we will discuss the analysis of this paper as such in the upcoming videos. This specific set, if I talk about set 2, is on the tougher side compared to the previous years. So what I would request you all is not to bother so much about what will be the cutoff, what will be other things related to the result of this exam. If you are preparing for NEET PG, just prepare for NEET PG. If you are a serious UPSC CMS aspirant, then you should not worry about it right now. If you are kind of happy with what you have done in your exam, you should start revising the subjects again, specifically for the interviews.